Hello everyone, I am Sridharan, Assistant Professor from the SNS College of Physiotherapy. So in this video, we're going to see about the topic which is based on the electrotherapy is laser therapy. So in this video, we're going to explore about the advanced laser therapy, its types, delivery methods, and the dosage parameters based on the physiotherapy aspect. So the main define of the electrotherapy is it clearly distinguish between the ruby laser, helium neon laser, and the diode lasers by using their wavelength and the penetration depth and as well as also the clinical uses to ensure the proper selection of the treatment. Second, we're going to apply for the laser therapy by using grid method and as well as also the scanning method. So these are the two different types of methods which can use it to highlight their influence on treatment coverage and as well as also perception over the patients. The crucial dosage and the parameters accurately quantify the energy density, pulse repetition rate, power output, and the radiation time to calibrate the laser therapy for safety and efficiency. The design safe and the effective laser protocols are they integrate the theoretical knowledge to tailor the laser therapy protocols specifically for the physiotherapy patients, maximizing the therapeutic outcomes while minimizing the risks. It also uses it to evaluate the laser therapy methods based on the patient specific factors to refine the protocols and improve the clinical effectiveness and the recovery rates. So there are three different types of lasers which gonna use it for the laser for the cryotherapy. So first we're gonna see about the ruby laser, where the ruby laser is mainly used for the pulse method and as well as also for the superficial treatment purposes. Uh, and nextly, moderate purposes, we're gonna use the helium neon laser, where by using the helium neon laser, we can use it to treat the patients in the continuous mode and as well as also for the moderate penetration. So, for during the superficial treatment, it mainly helps in the trigger points therapy, whereas in the moderate penetration, mainly it helps in increasing the cellular metabolism and as well as also the micro circulation, which aids in the wound healing and as well as also in the pain relief. Third, we're gonna use the diode laser. It is the versatile type of the laser therapy treatment. It also helps in the deep tissue therapy by penetrating deeper to the muscles. It mainly helps in reducing the inflammation production and as well as also in the tissue regeneration. There are two modes of treatment methods of technique mainly used in the laser therapy. So first one is grid method and second one is the scanning method. So in grid method, the laser beam is applied sequentially over the predefined grid pattern to guarantee uniform energy distribution across the treatment area, ideal for localized conditions such as the trigger points and the superficial wounds. During the scanning method, the laser handpiece moves continuously in sweeping motions, covering the larger or the irregular anatomical regions with the variable energy distribution suited for broader musculoskeletal conditions like the tendinopathies. The controlled dose of parameters mainly helps in the both technique require the precise regulation of the speed and as well as also coverage to prevent under or overdosing with selection based on lesion size and as well as also depth and the treatment methods. The critical dosage parameters in the laser therapy are the energy measured in the joules per square centimeter defines the total energy delivered per area, whereas the pulse repetition rate expresses in the hertz determines the pulse frequency per second, influences the tissue reaction, and as well as also managing the thermal accumulation during the therapy. The power output measured in the milliwatts or the watts control the energy emission rate. Higher power reduces the treatment time but requires the caution to prevent the tissue overheating. As well as also the radiation time in the duration of laser exposure on the target muscles. Longer the exposure increases the total energy, but must align the tissue tolerance to the avoid the damage. So we're gonna see about the dosage parameters shape of the laser in the tissue interaction. First, the energy density effects determines the photochemical and the photothermal responses, which the high values can cause the thermal ablation and as well as also the tissue removal. Second, we're going to see about the pulse repetition rate role. So the continuous thermal relaxation, higher pulse rates increase the cumulative heat, aiding the deep warming, but as well as also the risk of overheating burns if it is unmanaged. Third, the power output influence determines the penetration depth and as well as also the treatment length. Balancing the power ensures the effective therapy while minimizing the tissue damage. And finally, we're gonna see about the radiation time impact. The longer exposure raises total energy delivered. Excessive duration may fatigue tissue. So the treatment length must be matched tissue type and as well as also according to its condition. So the real life applications are the diode laser effectively treats the Achilles tendinopathy. The helium neon laser accelerates the diabetic ulcer healing as well as also the pulsed ruby laser provides the immediate trigger point relief. So these are about the general aspects of laser therapy in the electrotherapy point of view. So that's all for this video. See you on next video. Thank you.